All right, so now we're going to talk about common injuries in swimming. All right, so what's unique about swimming? Swimming, if you've ever done it, is a total body workout. We're not talking about leisure swimming where you go and sit in the pool or go to the beach. We're talking about a lane pool where you're going back and forth. You may think you can do it for a long time, and then you get in and you're like, wow, I did one lap and I'm done for the day because that was really exhausting. Now, the unique thing about swimming is there's only really one way to train. You train by swimming. You do a lot of swimming. There is some what they call dry land, which is out-of-body workout, which is mostly focused on strength, but can also be focused on flexibility and fitness as well. This has the second highest average household income among participants, according to the Aspen Institute. Now, it makes sense, but most injuries occur during practice, right? They practice a lot for a really short period of competition, right? They may spend hours and cumulative amount of days and weeks practicing for just a couple of minutes of competition each time they compete. And so oftentimes they get overuse injuries. And this neat study showed that most swimmers get 4 injuries for every 1,000 hours of training. So the more you train, it may help you get faster, but it's also more likely that you're going to get some injuries as a result. So what are the swimming injuries that we see? Well, this may be intuitive well. The most common is in the shoulder. Namely, you get some tendonitis of the shoulder, but you also get something called impingement, which is a medical term for pinching that we use from all that rotation of the shoulder that happens over and over and over again. The second thing that we most commonly see are knee injuries, particularly in breaststrokers, because what they do is they do the frog kick, which is a little bit different angle as opposed to your standard flutter kicking. And so oftentimes we'll see more chronic knee injuries in breaststrokers. And then the third thing is spine and truck injuries that we see in swimmers. A unique injury that is overall not that common, but when we do see it, it is most commonly seen in swimmers, is something called thoracic outlet syndrome. And what it is it can be an entrapment of the nerve and or the blood vessels of what's called the thoracic outlet, as pictured here. So we're going to go through and identify the spots where these nerves and or vessels may get entrapped. So the green arrow there points towards the scalene muscles. And the scalene muscles are a group of muscles right where the nerve is coming out of the cervical spine. So if those muscles get really tight, they can irritate the nerves in those areas. Then as you go down, the red arrow shows the space between the clavicle and the first rib. And you can see that's a relatively narrow space in general. Then if you throw on top of it a lot of repetitive overhead motion, like what a swimmer would do, and they would possibly have some muscle imbalances, that could promote more narrowing of that space there. And that can pinch the nerves and or the blood vessels in that area. Then the last area is the pectoralis minor muscle. And you can see that pictured here by the blue arrow. And you can see with a lot of overhead movement, that can pinch or irritate the nerve or the vessels in that region as well. Well, if you pinch or irritate the nerve, what's going to happen? You're going to get nerve-type symptoms, pain, numbness, tingling. It can either be localized or sometimes it will go down to that upper extremity. But what about if you pinch or irritate a blood vessel? Well, that can lead to blood clotting, which is a bigger deal in medical terms. That's a more serious condition that we have to be aware of and treat more immediately. So how is this treated? Well, just general principles. If it's just the nerve involved, we call it neurogenic. And the first line of treatment is non-surgical, right? Activity modification. I try to convince them to take a break from certain aspects of swimming, right? A lot of physical therapy to help stretch out and balance out those muscles that are involved. And then surgery can be recommended if conservative measures fail. But what if the blood vessels are involved? Well, oftentimes we don't know they're involved until there's something serious that's there, including a blood clot, okay? And so it's more important that we address that clot and then do something so that the space where it's getting pinched is no longer going to pinch or irritate that area, so that reduces the risk of further blood clots. So there's a lot more involved in bigger surgeries that are needed for those. All right, this is Krista Settle. She's a physical therapist, a great physical therapist here at Scottish Rite that has 15 years of experience working with swimmers. So she knows a lot about swimmers and a lot about these injuries. This is advice from her. For swimming, good form is key, all right? So that is one of the most important things. Any swimmer should have a program that has both strength, endurance, muscle balance, and flexibility. You need all four of those aspects for a good program for a swimmer, all right? But most importantly, if you do have an injury, do not train through an injury. Find alternative ways to still train. If you keep pushing through it, it's just going to get worse and worse and worse. So what are some tips in regards to that? With swimming, there are some tools that you can use if there's an injury involved, right? There's buoys, kickboards, fins that can help take the stress off certain joints and be helpful while people are dealing with an injury and still allow them to do some training. If you do see thoracic outlet syndrome, even if it's just neurogenic, you refer them over to a medical provider so that can be addressed and hopefully eliminated before it gets more serious. And then the last thing we'll hit on is gradual return to swimming after an injury. One of our good athletic trainers here, Alan, with the help of Krista, made this return to swim program. The key here is that it needs to be gradual, right? Don't go from 0 to 100 miles per hour once the athlete is feeling better. This return to swim handout will be available to you all both in person and virtually afterwards.